Hello friends, today I am going to talk about the minor ailment in pregnancy. Means during pregnancy period, what are the difficulties faced by the mother during her pregnancy period. So there are some of the difficulties, like it doesn't mean that all the mother will get all this difficulty. It depends on the individual to individual. Some mother might not feel any difficulty and most of 90% will may have those ailments, and how we can manage from those kind of discomfort of the mother during her pregnancy period. So let's see the first symptom or the first minor ailment in pregnancy discomfort during her pregnancy period. First is nausea and vomiting, which is very common. Vomiting, nausea, especially during morning time when she wake up in the morning soon after getting out of bed. Okay, so are usually common during primary gravida mother. Primary gravida means the mother who is pregnant for the first time. So usually this nausea and vomiting is common in this kind of mother. So they usually appear during the following the first or second missed period and subside by the end of first trimester. जब पीरियड मिस्ड हो जाता है from the first to the second week, first or second missed period, and nausea vomiting will subside at the end of her first trimester. Trimester means during the pregnancy we have divided to 3 trimester, that is 3 months each. First trimester is termed as the first 3 months of pregnancy. Second trimester, the second 3 months, that means from starting from the 4th month. Okay, so it goes on till the 3rd trimester, that is total of 9 months. So these 3 main measures can reduce the problem. What are the main measures? First is dietary changes, to take like toast, advise the mother to take dry snacks and small and frequent meal, not eating at once. Okay, the small and frequently can be provided, and behavior modification like to avoid personal triggering factors. The woman can identify herself. Woman will know by herself which kind of factor is triggering her more into the nausea and vomiting. Like sometimes she don't like the smell, she don't like this food, a particular food. So she herself knows that and she can avoid from that. So the woman can identify herself this factor. So initial supplementation with vitamin B1 and B6 can be started with the supplementary. Then second ailment, second discomfort, that is backache. So mother feel back pain is common problem. 50% of the mother have this issue during her pregnancy. So physiological changes that contribute to backache are like joint, ligament, then because of weight gain. Okay, weight gain will be there. Then hyperlordosis and anterior teeth of the pelvis, when the mother uterus keep growing forward and upward direction, the spine, the back side keep moving, is like giving pressure towards the anterior part. So this also may lead to the back pain and muscular spasm of the brain, and also may lead to the constipation and urinary micturition because of compression. So how it can be managed? It can be managed by excessive weight gain should be avoided. Avoid the excessive weight gain. Try to maintain the weight, and rest and elevation of the leg to flex the hip. It may be helpful while resting. Just elevate the leg high up. Then massaging the back muscle. Also, if it is very severe, then in case of necessary, analgesic can be provided, and rest relieve the pain due to muscle spasm. So we can provide some rest to the mother in case she have a of the gut, the muscle relaxation is more, okay, and the gut due to effect of progesterone, then the diminished physical activity, reducing of physical activity because of pregnancy process, and pressure of the pelvic uterus, when the uterus gives pressure towards the intestine or rectum, okay. So on the colon are the possible cause or explanation which I can say why constipation occurs. So regular bowel habit may be restored with advice. What are the advices? Like taking fiber-rich diet, proper maintenance of fluid. Okay. Then the next complication, or we say not complication, the next ailments, minor ailments, minor discomfort is leg cramp. Leg cramp usually happen. It may be due to deficiency of diffusible serum calcium or inhibition of serum phosphorus, may be due to that. So how we can manage is supplementary calcium therapy can be provided. It can be in tablet form, can be in syrup form. Okay, then massaging the leg can be given, application of local heat therapy can be given, and also intake of vitamin B1 at least 30 mg daily may be effective to reduce the leg cramp. Next element is acidity and heartburn. Heartburn is common in pregnancy due to relaxation of esophageal sphincter. Okay. So how can manage? Patient is advised to avoid overeating and not to go to bed immediately after eating. This way for some 1 or 2 hours can be prevented. Then the liquid antacid may be helpful also for this acidity in case prescribed by the doctor. Next element is varicose vein. Varicose vein here is in the leg and mostly in the vulva, which is called as varicositis, or rectum. It may happen, that is formed, if it's formed hemorrhoid, may appear for the first time or aggravate during pregnancy. So usually in the later month, it is due to obstruction in the villus uterus by the pregnant uterus. So there is the, how can we manage for leg varicositis? Elastic crepe bandage can be wear by the mother during the movement, and also inhalation of urine during rest can give a symptomatic relief, slight relief. Then specific therapy is better to be avoided because varicositis usually disappear following delivery. After the delivery, usually it disappears. So try to avoid as much as possible the specific therapy. Instead, we can manage if it is manageable, if it is not that severe. Next one is hemorrhoid. Hemorrhoid, it may cause annoying complication like bleeding, okay, if it is severe, or may get prolapse. So how can manage? Regular use of this one, bowel softening can be used. Otherwise, in the diet modification, proper fiber-rich diet or hydration. Okay. Also, local application can help of hydrocortisone ointment can be provided as prescribed by the physician, and replacement of the pile if prolapse are essential. So surgical treatment is better to withhold because as it is the condition sharply improve following delivery. After the delivery, the condition might improve. So certainly avoid as much as possible the surgical treatment. Number 8 element is carpal tunnel syndrome. Mostly 10% of the mothers have this syndrome. So what is this? Women present with pain and numbness in the thumb or index finger and in the middle finger. So there is weakness in the muscle for thumb movement. So this is due to wide compression effect in the median nerve. injection, the median nerve. So how it can be manageable? A splint is applied during sleep time to the slightly wrist to give relief. Okay. Then corticosteroid injection may prescribe or surgical decompression is rarely needed, but it resolves spontaneously after the delivery. That is why we consider as the minor. It resolves after the delivery. These all are the symptoms during the pregnancy. And so 9 months round ligament pain. So stretching of the round ligament during movement in pregnancy may cause sharp pain in the groin. Okay, so it is usually felt during second trimester. Second trimester is from the 4th month of pregnancy till the 6th month of pregnancy. Usually it feels that pain may be awakening at night time usually because of sudden roll over movement during sleep. How it can be managed? Pain may be reduced by making movement gradual instead of sudden. Okay. Local kid application can be helpful in this case, or analgesic are rarely prescribed, but in case necessary otherwise. Number 10 is dialysis. Dialysis means increased secretion of saliva is observed during this symptom is observed during pregnancy. This problem is usually because of self-limiting. Sometimes we restrict the diet, restrict the food, what the mother are craving, and may be overcome by decreasing the intake of carbohydrate. Okay, it can be overcome by decreasing the intake of carbohydrate diet. It is not associated with any adverse pregnancy outcome. It will not give any complication to the pregnancy outcome. This is just a ailments. So some mother might feel, some might not feel this symptoms. Next is syncope. Syncope is termed as like suddenly sometimes mother felt mother go unconscious suddenly. So it is often seen in a woman following prolonged standing and standing upright abruptly. Because when the mother continuously standing or standing in the upright position abruptly for a prolonged time, the syncope may happen. So this is due to pulling of blood. When the blood is pulling to the gravity in the veins of the lower extremities. Other causes may be dehydration, hypoglycemia, or over exertion. So left lateral position manage how to manage syncope usually resolve rapidly on lying in left lateral position. So syncope in supine position is also managed by resting in lateral recumbent position. Okay. So recurrent syncope needs cardiological evaluation. If it is severe, then you can consult a cardiologist. 12th one is ankle edema. Ankle edema also commonly we see during the last, especially during the last trimester. So excessive fluid retention as evidenced by marked gain in the weight or evidence of preeclampsia has to be excluded. In case if any other condition mother have a high blood pressure or preeclampsia, in that case we can exclude because that edema might be the symptom of those complications, those conditions. So in normally Ailments edema may develop. So if mother has not that other condition, then excessive fluid retention may be because of some other reason. So management, no treatment is required in case normal mother. For physiological edema or orthostatic edema, no treatment required. So edema subside on rest with slight elevation of the limb. Diuretic should not be prescribed during the pregnancy, so we can manage with slight elevation of the limb. Then the last ailment is vaginal discharge. So assurance to the patient and advice for local cleanliness are all that are required. So if there is any vaginal discharge is observed, then ensure the patient or the mother is maintaining proper hygiene, cleanliness. So it might be because of presence of infection also if it is severe and orderly discharge. So presence of infection should be treated with vaginal application of metronidazole can be prescribed, or